So welcome everyone. We are here today for our fourth of the series on kidney cancer. March was Kidney Cancer Awareness Month, and we've been doing a series so that people understand kidney cancer and know that it is treatable. There are many more options now available, and it's not to be feared. Today, we have the privilege of having with us two doctors who are experts in their field, Dr. Aditya Murali, who's consultant medical oncology at Apollo Hospital, Bengaluru, and Dr. Srinath Bharadwaj, consultant medical oncology and hematology at Apollo Cancer Institute at Jubilee Hills in Hyderabad. Quick reminder, PatientsEngage is an online platform for patients dealing with chronic diseases to share their experiences and learn from each other. And also learn from healthcare experts that we bring through our various content types and use this information to make better decisions. So, and we strongly believe that the better informed people are, the better they will be able to manage their condition. And we've always put patients and survivors at the center of all of the work we do, and all of our content is driven by our conversations and learnings from patients and survivors. As I said, this is the fourth. Previously, we have spoken to various doctors on the signs and symptoms of kidney cancer, both in English and Hindi. We've talked of navigating treatment options for kidney cancer. And today we are going to talk about living well once you're diagnosed with kidney cancer and after. As I said, we have with us Dr. Srinath R Bharadwaj and Dr. Aditya Murali, and I'm Aparna Mittal, founder of PatientsEngage and the moderator of this session. This session is supported in public interest by Merck Pfizer Alliance, and the objective is for public awareness, and it does not replace a consultation. So please do consult your doctor or any of our panelists for specific medical issues directly. The views expressed are of the panelist and are only meant for spreading general awareness and do not necessarily reflect that of the platform or the sponsors. If you're watching live, you can post your questions on Zoom or Facebook or YouTube. Otherwise, you can always contact us later through our social media channels or our website, patientsengage.com. So let's get started. Thank you, Dr. Aditya and Dr. Srinath, for joining us today. As I said, today we will talk about living well after kidney cancer. So Dr. Srinath, if you can talk to us a little bit about, again, just make sure that people understand what is kidney cancer. So if you can start with that.
So any tumor or a growth which is found in the body, which is not supposed to be there, which is rapid proliferation of a certain mutated cells, which manifests itself in the form of a tumor, is a cancer. So if it's found in the kidney, it's called kidney cancer. And there will be multiple types of cancer, but there is one specific type in kidney cancer called the clear cell variant, which is the most common type which is found. And there are several other cancers which the pathologist types once we send a biopsy or the entire kidney after the operation to the pathology lab.
Right. Thank you. Dr. Aditya Murali, can you talk us through the various treatment options and how kidney cancer treatment has changed over the years?
Kidney cancer treatment depends primarily on what stage of disease we are dealing with. If it's a localized disease or is it a disease which is spread beyond the kidney to other organs. So if it's a localized disease, then the treatment of choice has to be a surgical removal of the tumor. Now, is it only the tumor which needs to be removed, or is the whole kidney which needs to come out? That depends primarily on the extent of the kidney involved, and that's the decision which the surgeon will make after examining the patient. However, if we're talking about disease which has spread to other parts of the body, then essentially we are looking at a situation wherein we will not be able to eliminate the disease or cure the disease. We are looking more at sort of a disease control and prolongation of life with maintaining the quality of life. towards this end, kidney cancer is one of those very few rare cancers wherein chemotherapy has got absolutely no role at all. All kidney cancers for the longest time were treated with certain chemicals called as interferons, and they formed the backbone till about the early 2010s. Subsequent to that, advances sort of found out what is the driver which is driving kidney cancer formation. Can we give any medicine to attack the abnormal blood vessel proliferation? And if we can stop that, we can potentially control the cancer. So towards this end, we started off with targeted therapies. And in the last 4 or 5 years, immunotherapies have taken over and have become the standard of care for treatment of kidney cancer. So today, if we have a kidney cancer which has spread to other parts of the body as well, unless there is an acute symptom like life-threatening bleeding, what we look at is a combination of targeted therapy and immunotherapy.
Thank you, Dr. Aditya. Dr. Srinath, Dr. Aditya just talked of the way how kidney cancer treatment has changed, but how have the survival rates improved now with these new treatment options?
So, if I can mention, I have my own grandfather who was treated for kidney cancer. And as Dr. Aditya rightly pointed out, once we started using targeted therapies, he survived miraculously for 10 years. So it was magical initially. And now from maybe 2018-ish, this is one axis, the targeted therapy. A bit more explanation as to what targeted therapy is. So whenever there is proliferation of cells, that is the tumor, it depends on the blood vessels in the body. So it takes new connections, just like we make a new house, we take a new power connection, water connection. In the same way, it takes connection from the existing blood vessels to its own cell. So these targeted therapies have been successful in preventing that, and also controlling the tumor growth. So that is one thing. The other way which the tumor used to thrive is it used to mask itself from the body's immunity. So that it used to escape the immune surveillance of the body. So there is in 2018 there was a path-changing discovery in oncology called immunotherapy, which kind of unmasks the tumor and activates our body's immunity to fight against the tumor. So now the standard of care has been combining these two axes, where one to cut off the blood supply, other you activate the body's immunity in the form of T cells to attack the tumor. So the combination has worked and it has given the best results so far. So now I think there is a fresh lease of life for anyone detected with this cancer, though it is stage 4 and it has spread beyond the kidney. So these patients are doing pretty well with a very good quality of life. As Dr. Aditya mentioned, there's no chemotherapy. So these targeted therapies have limited side effect profile, and most of the patients tend to do very, very well on those therapies, and they have a long life and also a very good quality of life.
Thank you. And both of you have talked of spread to other sites. Dr. Aditya, can you talk a little bit about the common sites of metastasis for kidney cancer?
So the commonest site where kidney cancer spread is the lungs. So kidney cancer more often than not spreads via the blood vessel pathway, or the hematogenous spread is what we call that. So one of the commonest sites has got to be the lungs. Apart from lungs, bones is another site where kidney cancer spreads quite frequently. There is a possibility of kidney cancer spreading to the brain as well. It is very rare to find kidney cancer spreading to the liver or to the intestines or any of those other areas, but lungs, bones, and sometimes the brain, these are the commonest sites.
Thank you. And depending on the site of metastasis, does the treatment change? Or not really?
Sort of. Sort of it does. if we have a kidney cancer which is not spread to too many areas, there are just one or two small areas of spread in the lung, then we might still try to potentially offer a little bit more of a radical approach in terms of going in, debulking the disease by removing, or the cytoreduction surgery is what we do by removing the tumor out, and then whatever disease is left behind, then we treat that with targeted immunotherapies. However, if there are too many sites of disease, then the treatment obviously is going to be a systemic therapy. Another peculiar issue with kidney cancer is kidney cancer can go to the brain or to the bones. So if that happens, if there is an isolated site in the brain, we do surgically excision of the brain site to treat the kidney cancer. So that is one area wherein we do surgery. So if apart from this, if the kidney cancer has spread to the bones, and if the bones are at risk of being fractured, or there is a severe pain which is going on, then in such a scenario, we might want to do radiation right to that area of the bone, more of for a symptomatic treatment rather than for a prolongation of survival.
Thank you. Thank you, Dr. Aditya. Dr. Srinath, we have a whole list of issues that patients have raised. So if you can, and maybe I'll go, maybe for each one of them, if the two of you can talk about whether it's a complication of the cancer itself or it's a side effect of the treatment, and therefore how it should be managed. So, like things like, and I'll broadly cover them first, is like diarrhea, rash management, anemia, fatigue, hematuria, swelling, pain, weight loss, and cachexia, right? So let's take first diarrhea and rash management. Is that a side effect of the treatment, or it is a complication or a result of the cancer itself?
I'm taking it, or?
Yeah, go ahead, Dr. Srinath first.
Diarrhea and rash definitely are due to the targeted therapy, which we have talked earlier, which cuts off the blood supply to the tumor. So I'd say it's the side effect of therapy rather than the manifestation of the tumor itself.
Right.
So I think that is quite controllable, and I don't see any problem with it. Sometimes certain drugs cause a skin discoloration, and many people come back to us saying that, doctor, my skin has turned yellow. Please check my liver function. So all that will be normal because it's the side effect of the drug.
Right.
So nothing to worry. I think they are pretty much manageable. I think if you see the risk versus benefit ratio, the benefit they are offering, I think this is a very, very minimal risk, I would say.
Right. And, these can be managed, right? There are solutions that the doctor might be able to suggest.
So not at all a problem.
Right. Dr. Aditya, if you can talk about anemia and fatigue.
So anemia and fatigue can be a result of both the treatment, the TKIs, the target therapies which we may use, but kidney cancer itself is known to cause anemia. So some of the there are something called as a prognostic factor which tells how aggressive the tumor is, and if a patient has anemia along with the kidney cancer, then we know that the tumor is more aggressive than the other ones.
Right.
So anemia is a very tough problem to deal with when a patient has kidney cancer. Fatigue is two multifactorial over here, at least two main factors. The primary factor would obviously be if the patient has anemia, that itself can drive the fatigue and reduce the quality of life.
Right.
But some of the targeted therapies that we are using, these anti-blood vessel proliferation agents, they also have this very typical, as a class effect, they have this problem with fatigue. So often at times, if the anemia is fairly well corrected, we may even have to go up or down on the dose because the fatigue will cause, a significant impact on quality of life.
Thank you. And does fatigue, some of the fatigue can also be managed by lifestyle modification? Is there a role for lifestyle modification for fatigue?
And that's a fantastic point which I bring up in my clinic every day. Lifestyle modification in general helps tolerate any treatment better. So it's not just fatigue, it is low appetite, low energy, low drive. All of these are far lesser when we have issues in terms of lifestyle management, and particularly lifestyle management does not need a strict regimen over here. Simple things like getting up on time, having a fixed routine, fixed eating or a food schedule. Uh, Exercises is a very often discussed topic by cancer patients in our clinics. We cannot prescribe a single set of exercises because there are certain scenarios wherein the bones might be weak and some of the exercises might impact on that. But generally, things which involve stretching the body, certain yoga postures, the breathing exercises, they do mitigate all of these side effects to a significant extent.
Thank you. Thank you, Dr. Aditya. Dr. Srinath, if you can talk about hematuria and swelling.
Okay. Swelling and hematuria are only present when it is detected. As we go into the treatment, I think they do disappear with the response to therapy. So,
Okay.
As you rightly asked Dr. Aditya about the anemia, loss of blood through urine is called hematuria. So,
right.
Even that is one of the major factors which contributes to anemia. So, and as we go through the treatment, I think both the swelling in the kidney and swelling elsewhere, and also the bleeding through the urine. Obviously, the tumor has a lot of blood supply. It has taken a lot of blood supply. So, it as it shrinks, all that loss of blood through urine also comes down. So, I think that they don't matter once the treatment is working.
So typically what you're saying is, I mean, we know that hematuria or blood in the urine is one of the symptoms of kidney cancer also. And
it can be,
once the treatment...
It is one of the important symptoms of kidney cancer. It can be due to any cancer throughout the tract. It can be kidney, ureter, bladder, sometimes even prostate. So whatever the tumor, kind of overgrows and keeps bleeding can cause hematuria.
Right. And in most cases, it should, most or all cases, it should reduce once the treatment is underway.
Once the treatment started, immediately it starts reducing, and at least the frequency reduces immediately, and a couple of cycles, it totally disappears.
Okay, thank you. And if you can also talk, Dr. Srinath, on pain, because sometimes people do talk about pain a lot as well.
There are two types of pain. One is the abdominal pain, because once the tumor arises out of the kidney and stretches the capsule of the kidney, there will be a lot of nerve supply to the capsule of the kidney. Sometimes that manifests as pain, abdominal pain. Again, as I told, once we're through the therapy, it starts reducing and disappears slowly. The other pain is when the cancer has spread from the kidney to the bones. So that is the only pain. As Dr. Aditya previously mentioned, we tend to give radiotherapy to particular bones which are, having high tumor burden and causing a lot of pain. Or if there is, most of the times spread to the bone means spread to the vertebrae. So vertebrae are important for the postural stability, and their body is balanced on the vertebra. So there will be a tendency to, for a fracture, there will be a risk of fracture when we don't treat it immediately with radiation. And sometimes if it overgrows into the spinal canal, so the tumor also can cause pressure on the spinal cord, causing paralysis of the two legs. So all those are scenarios which can cause severe pain and sometimes paralysis. And we do deal it with radiotherapy most often. And also, of course, simultaneously, we do give very good painkillers, not controlled by the initial painkillers like paracetamol and stuff like that.
Right. Thank you, Dr. Srinath. Dr. Aditya, if you can talk about weight loss and cachexia as well.
Weight loss cachexia again is multifactorial, just like fatigue over here. Even the disease itself can cause significant amount of cachexia left untreated.
Okay, sorry, can you explain cachexia to?
So cachexia basically means wasting away of the body's muscles. The body is so devoid of nutrition and so hungry for some kind of energy that it starts breaking down the muscle mass in the body to convert that into energy. This happens when all other sources of energy have been exhausted and the patient basically turns into a skin and bone. That is the most common way of describing this. So that is cachexia. And cachexia is one of the hallmark signs of an advanced stage of any cancer, not just kidney cancer. Any cancer cachexia can be there. But so even in kidney cancer, in advanced stages, cachexia will be an issue. However, the problem is we still don't know, or we've still not found out a good way of dealing with the cachexia. Now, cachexia not just leads to the body physiological issues. There is also the problem of quality of life. So once somebody becomes cachectic, they are not able to do any day-to-day activities, and that severe restriction further worsens the quality of life. So it is a significant problem in any advanced stage kidney cancer. By and large, none of the treatments cause cachexia. Weight loss may be seen with some of the treatments, but it is given the fact that we are not giving chemotherapy in kidney cancer, it's not that common.
Okay, thank you. And I know that, Dr. Aditya talked about lifestyle changes, but do they have a role in terms of, okay, let me rephrase that. What can be done to reduce risk of recurrence? So, is kidney cancer one of those cancers which, especially if you've got it at an early stage, you treat it curatively with surgery, and then, people are always looking at what do I do to prevent its recurrence? So if you can talk about, Dr. Srinath, if you can talk about what patients can do to manage or reduce the risk of recurrence.
I would rather give a philosophical reply to this rather than a scientific reply, because if you ask me, there is now no one thing that the patient or the doctor can do to reduce the recurrence, frankly. Now we have some data as to include these targeted therapy and immunotherapy in the setting where we have done an operation in the early stages, and there's some data coming up that it can prevent recurrence, but it's not so robust as much as in other tumors.
Right.
So I would rather say, as of now, follow the standard treatment, and fingers crossed. And it's very difficult to tell in whom it will recur very quickly and in whom it will not. Frankly, I think there's no one answer for that. And
right.
We just have to, as Dr. Aditya told, I think follow a healthy lifestyle and it's all general guidelines. There's no one answer.
Right. Thank you. And in terms of, what is the monitoring protocol that you advise kidney cancer patients first during the treatment, and if it was a curative after the first, kind of surgery, then what is the monitoring frequency, Dr. Aditya?
By and large, any curative cancer, once the radical treatment has been done, we would like to see them once every 3 months in the clinic for the first 2 years, and subsequently once every 6 months for the next 3 years. Now, kidney cancer is sort of unique because most of the other cancers that we know, if they have to recur, they recur within the first 2 years. So the follow-up is almost always more frequent in the first 2 years. But when it comes to kidney cancer, there is no a single time frame. Kidney cancers are known to recur even after 5 years. So there is no one point of time and saying, okay, it's not come back till now, it's never going to come back. So that's one aspect. The other aspect is that even when we call a patient for follow-up, it's highly unlikely that any of us, Dr. Srinath can also give his inputs on this. It's unlikely that we would do a scan every 3 months. And even if we do a scan, it probably is going to be something like an ultrasound wherein there is no radiation exposure, but ultrasounds are not very sensitive in picking things up over here. So essentially, just call the patient back to the clinic every 3 months, ask how they are doing. If there are no symptoms, just leave it at that. If there are symptoms, then chase it with some sort of radiological investigation.
Dr. Srinath, would you like to add to that?
Absolutely. So it depends on what is the location of the tumor that we're treating. So say if somebody has a kidney tumor spread to the liver and there was nothing in the lungs at the onset of tumor. So we do only an ultrasound abdomen and just get away with that. And of course, if there is a tumor only in the lungs, let us say, so we have to do an X-ray at least, to just rule out any interval changes. And of course, we try to avoid radiation as much as possible. That's always there. And again, any particular site of symptom, say only lung, and we're only monitoring the X-ray of the chest. But say he says, I have a lower back pain today. So I think we have to do an X-ray of that part also to see if everything is okay, or is there any, sign of spread of cancer to that particular part. So I think that's all is what.
Right. And in terms of the one question we received is the follow-up. Who is the follow-up with? What specialty should patients be following up with?
Medical oncologist, of course.
Right. Okay. And since our topic is living well after kidney cancer, and we've talked of quality of life, etc., but there's also a lot of stress and anxiety that patients and their families go through. So, what is your message? And this is to both of you, Dr. Aditya and Dr. Srinath. What is your message to patients who are living with kidney cancer and feeling anxious and stressed, etc.?
All I can say here is that, to borrow a leaf from my colleagues' advice, give it a philosophical answer. Tell them that it is not a 100-meter dash, it is a marathon. Every day will have its ups and downs. Just because something good happened today doesn't mean, you suddenly go on to a complete high. So you celebrate your victories in terms of any remission of or any kind of a response to treatment. However, if anything bad goes, it does not mean that it's the end of the world. The way science is evolving is that it's at a tremendous pace. Who knows, in 5 years we might have a whole new class of medicines to treat this particular condition. So science is evolving. There are a lot of treatment options. Treatment is getting safer and lot more tolerable as time passes. So take one day at a time, and let's not look for absolutes. That's all.
Thank you, Dr. Aditya. Dr. Srinath?
I think Dr. Aditya has put it very well, leaving nothing for me to add to it. So I would say, absolutely, to add just one point to that, just believe in your doctor, and because we do, keep ourselves very much updated, and for all our patients. So we just believe in your doctor, and keep going ahead, fighting ahead, because all of you are fighters. And there is definitely no need to feel anxious, as Dr. Aditya clearly pointed out. It's a marathon. So I can compare it. Maybe it's not so simple as I compare it. It's like a test match where you have to fight it out for long. It's not that you're going to get some instant solution to it. So feeling anxious, you're not going to achieve anything as such. So just believe in your oncologist and fight it out. And any problems, just have a dialogue with your oncologist so that he can help you with your symptoms. He can help you regarding anything. Any other problems in life which are adding to that anxiety apart from the health condition. I think it's only a dialogue between you and your oncologist which can allay your anxiety completely.
Thank you, Dr. Srinath and Dr. Aditya. Anything else that you would like to add to our audience, given that this is the last session of Kidney Cancer Awareness Month?
No, I think we have covered everything. Just to reiterate what I said, cancer is about fighting. It's not about giving up. Celebrate your victories. Do not look at one bad turn as the end of the road. Believe in the science. Science will get you through.
Thank you, Dr. Aditya. Dr. Srinath?
I think every cancer patient is a fighter, and we're very inspired every day how they get over their troubles and still lead a near normal life. Of course, our therapies do help to control the tumor, but as you rightly told, there's a lot of mental aspect to that, and that's I think there are two ways, as I told again. One is dialogue with your oncologist, and other is dialogue sometimes with your peers, like other somebody who has gone through it or something like that. So I think even that will help you to pass through this, and I think most of the patients will emerge victorious with the kind of revolution in science that's happening now.
Thank you. Thank you, Dr. Srinath and Dr. Aditya, for taking your time. So I think, over the last, over this month, we've covered a lot of aspects of kidney cancer and looked at it from understanding the signs and symptoms so that people can get diagnosed early and get treated early. We've talked of the changes in treatment options over the last few years and how that has improved survival rates. And therefore it is, and we've also talked of the fact that there are side effects, there are complications, but a lot of it, most of it can be managed. So it is important that patients and families understand the disease and how to manage it, have open dialogue with your treating physician and oncologist, and do not fear cancer, right? I think cancer is increasingly can be managed like a chronic condition, and it's not a death sentence. So stay updated with the latest, and your doctors are doing that. You can also do it, and focus on the science and the progress that's happened. And as Dr. Srinath also said that, there are support groups, there are now survivors of all of these conditions, all types of cancers. So do reach out to connect with them and, have those conversations as well. So thank you once again, Dr. Srinath and Dr. Aditya, and to our audience for tuning in for kidney cancer.
I thank you for this opportunity to interact with all of you. Thank you so much.
Thank you and have a good day. Thank you.